Hey, my name is Brian. I'm with Fairbanks Urology, and I'm here with Zach Ritter, our PA, here to talk about just some questions that we may have as the general public. Today, we're going to be talking about erectile dysfunction, ED. So, Zach, just first question: what is ED? What are we talking about?
Well, erectile dysfunction, not something that a lot of people like to talk about, but it's very important because it's important to everybody. So erectile dysfunction is when your penis fails to either become hard enough or stay hard for long enough for sexual intercourse.
And what typically causes it?
Unfortunately, there's a long list of things that can cause erectile dysfunction. Anything from obesity to poor heart health, to high blood pressure, to high cholesterol, low testosterone. Some of the medications you're taking could be the cause of some of your issues. Unfortunately, it's a big, wide list, and any one or all of those could be contributing to your personal issues with erections.
Hmm. A lot of things can cause it. So, how common is it?
Unfortunately, it gets more common as you age. So even young men can run into this. One of the things I forgot to mention is stress. Stress can cause erectile dysfunction. I see that a lot in young men who don't have a physical problem, but a lot of erections are a mental issue. So even young men can have stress in their lives, stress in their relationships that can cause erectile dysfunction. As you age, some of those other things can come more into play. So obesity, high blood pressure, medications as you age. So it gets more common as you go up in decades. And it's not atypical for, a lot of men to have issues with these problems to some degree, especially as they get into the 40s, 50s, 60s, and 70s.
Hmm. All right. And so what can men do if they do have it?
It's a great question. So there are a lot of things that you can do in your personal life with lifestyle changes to help correct erectile dysfunction or prevent it from happening. One of the biggest things that you can do is to stay near your ideal body weight. So obesity and being overweight is a big player in terms of erectile dysfunction. So anything you can do to keep the weight down or lose the weight that you have now can make a huge difference. And that can make a huge difference in the other things that can affect erectile dysfunction as well. So getting your weight down can help your diabetes, which can also impact erectile dysfunction. Lowering your weight by getting in shape and exercising more can improve your heart health. So you need a good ticker in order to perfuse or get blood supply to your penis to get good erections. So dropping the weight, exercising, and then just tackling those other health problems like high blood pressure. If it's not being treated, talk to your primary care provider, get treatment for your high cholesterol and high blood pressure. Those are kind of the silent killers because they don't necessarily give you a lot of symptoms now, but left untreated for years can cause problems like erectile dysfunction. One of the other things that if you are on medications for other diseases, check with your doctor or check with us, the folks at Fairbanks Urology, to see if the medications you're on can be affecting it. And one of the other important things is that you can get your testosterone checked. So low testosterone can cause erectile dysfunction. And you might not necessarily know that without the test. So we offer testosterone checks here at Fairbanks Urology. If you're having a problem with erectile dysfunction, a lot of things you can do at home, but there's a lot of things that we can help you with in terms of medications that can help raising your testosterone if it's low, so you don't have to deal with erectile dysfunction.
Awesome. When's a good time to know, okay, I can handle this myself, I can lose the weight, versus I should go see a doctor about this? What's kind of the line there?
That's a great question. And the answer is really, we can do both of those things at the same time. So we can help you get erections now while you're working those other things. Because unfortunately, if you're overweight, that takes a while. It's lifestyle changes. That's, going to the gym, working out, or find something you love doing to get you exercising. But losing weight takes a while, and it's a hard process. And you don't have to struggle with erectile dysfunction while you're doing that. We can get you started on medications or other therapies that can help you so you can have a good sex life now while you're working on them. And then once you've changed enough for that to not be an impact anymore, we can take you off the medications. You might not need them anymore. So the answer ideally is, both. You don't have to suffer from erectile dysfunction while you're making those lifestyle changes.
All right, thanks, Zach, and thanks for watching this video. If you have any other questions or you want to see anything else, we have a lot more informational videos on our website, and feel free to make an appointment if you have any further questions. Otherwise, thanks for watching.
Have a great day. Hope to see you in the office.